Our special series, No Shave Today, has been helping to raise awareness about men's health issues. This morning, it's prostate cancer. According to the American Cancer Society, 1 in 7 men will get prostate cancer. Just last month, actor Ben Stiller revealed that he was diagnosed 2 years ago and treated successfully. He joins us now along with his surgeon, Dr. Edward Schaefer of Northwestern University's Feinberg School of Medicine. Guys, good morning to both of you.
How are you?
How are you? Well, forget me. How are you doing?
I'm doing great.
Yeah?
I mean, I was really fortunate, that my course of treatment was basically, an operation, and that was it.
So your status today in terms of cancer is
cancer-free as of today. And anybody who's had cancer, you just have to keep on checking on it. But I'm really fortunate.
I mentioned statistics a second ago, Ben, and I would imagine when someone tells you those words, you have cancer, statistics don't matter. You feel like the only one who's been told that.
Yeah, I mean, it's surreal. I think, it's not something that I was really thinking about. It wasn't on my radar at all. And if it wasn't for this test that we're going to talk about, I don't know if I would have had as easy a course of treatment or, the prognosis that I did have.
So background here, you were 48 years old when you were diagnosed, no family history, no symptoms.
There was cancer in my on my father's side, but not prostate cancer specifically.
But your primary care physician, not Dr. Schaefer, had been administering a PSA test for what, about 2 years?
Yeah, well, yeah, he brought up the test to me and said, hey, I want to give you this test, and he explained what it was, and he said it's just basically a test to see, and I guess when the first one came in, it was a little high, and he said, I just want to keep giving you this test for, every few months, about every, 4, 5, 6 months, to see what happens.
And I hear that story, doctor, and I say that is your best case argument for the PSA test, and yet we all know that it's controversial. Why?
It's controversial because prostate cancer is a common cancer. 1 in 7 men will have it, but not everybody who gets prostate cancer will die from it. So we have to really better identify those who have a lethal or aggressive cancer from those that do not.
But okay, so what would be the downside to at least testing?
Well, in my mind, there's not a lot of downside for a patient to know their stats and know where they stand. But some would argue that if the test is elevated, it may lead to unnecessary biopsies or additional tests, which could cause anxiety for the patient.
When you finally came to the decision to treat this, you opted for removal of the prostate. There are other options. Why did you fall on that option?
Because that's what my doctors recommended.
Yeah. And I'm listening to my doctor.
I am not a doctor,
right?
But I talked to them, and Ted told me, what he thought. I talked to a number of doctors before I settled on Ted, and I didn't settle, by the way, at all. But he offered
Thanks for that, Ben.
He offered a great deal. And the thing is, it's a whole new world, so you have to educate yourself, and that's, for me, it was learning what the options were. He told me about what he thought the best course of treatment would be for the tumor that I had, and so I opted for the operation.
We hear about this operation, and the first thing a guy will tell you on a street or when you're at a cocktail party with that guy is, I'm not doing that because there's all kinds of side effects, impotence, incontinence, all that. What's the truth about it?
Well, there can be side effects with treatment, and there are, when a man is confronted with the cancer, it is important to understand what's the best treatment for them. Men can have difficulty with their urination and with their sexual function after treatment for prostate cancer. It's not just isolated to surgery. And so today, what we do is we try to do a better job recommending active treatment for men versus just watching their cancers.
In general terms, may I ask you if you've had to deal with any of the side effects?
Yeah, but I'm doing good.
Yeah.
All good.
Yeah. Okay. We'll read between the thumbs.
I settled for the right doctor.
Yeah.
No, I mean it's a real thing, though. I mean, those are all, but when you're confronted with the question of, hey, do you want to live, or do you want to make sure that your sex life is the best it can be? I opted for wanting to get rid of the cancer and then see what happens, and luckily everything's cool.
We did a survey with Dr. Oz as part of this month of men's health. Found this 59% of men we surveyed say they'd not discussed the risks and benefits of screening for prostate cancer with their doctor. 54% said they don't know what a PSA test even is. What would you say about that?
That's an amazing stat, and it's really upsetting to me as a physician, and this is what Ben and I are really trying to do, is talk about this. I think the best and most important step for individual men is to really discuss whether or not they should get testing for prostate cancer with their doctor. It's a personal decision.
Yeah.
You waited a couple of years before you came out and told our friend Howard about this. So clearly you must have a message for guys out there watching, not only in the month of November when we all get scruffy, but every month of the year.
Yeah. Yeah, I mean, for me, it's please talk to your doctor about this. Be aware. You know, if it was up to me, I'd say every guy should go and get tested after the age of, 40, 45, especially if you have a family history. The test itself is not harmful. It's what can happen after in terms of overtreatment, those questions. But those are all things you can discuss with your doctor. And if I hadn't taken this test, I wouldn't have known. I don't know when I would have known until it probably had become, something that was not going to have the outcome, in terms of the treatment that it did have. So
I'm happy you're okay.
Thank you, Matt.
And thanks for sharing the story and passing on the information. Doctor, great to meet you.
Nice to meet you
thank
too.
you very
Thank you.
much.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.